So since 1997, Congress hasn't increased funding for physician training. Meanwhile, 334,000 physicians left the practice during the pandemic. And, here's the brutal reality. 80% of remaining physicians are clustered in cities, leaving rural America in medical deserts. And the physician shortage undermines a fundamental principle of what we believe, right? That when we get sick, someone will be there to help us. Imagine needing urgent care, but the nearest available appointment is weeks away. This isn't some abstract problem. This is something that's happening today in America. And when diagnoses are delayed, something that's treatable snowballs into something that can become life-threatening. It feels like the system that we all count on is somewhat like a house of cards now. It's more fragile than we realized. But here's the uncomfortable reality. It's that this doesn't hit all of us equally. Right now, rural communities are watching their hospitals get shut down one by one, forcing residents, to make pilgrimages for basic care. People managing chronic conditions like diabetes or, heart disease, they need consistent monitoring. But what they're finding is that their doctors are overwhelmed. They're not there anymore. They moved. And the crisis goes deeper than healthcare access. Without enough doctors, right, who aren't in the wrong here, existing health inequalities are spiraling out of control in underserved areas. Preventable diseases are surging because people can't get the access that they need in a convenient manner or in a proper manner, or in a, what's the word? In an appropriate manner, right, to say the least. And there's also an economic impact to this, and it's staggering because a sick workforce means lower productivity. It means worse work, right, which isn't the end all be all for human beings at the end of the day. But what I'm getting at is that this isn't just a medical problem. It's threatening the very foundation of opportunity in the United States. Other countries have solved this by reimagining their healthcare pipeline. But can we reimagine what healthcare will look like in America by overcoming what seems like political gridlock in order to save our healthcare system before it's too late? That's the question.